Hello, Colin Hung here for Healthcare IT Today. I am here in Kiowa River, South Carolina, where I have been attending the E3 Executive Summit put on by Kyruus Health. I'm about to sit down with Peter Beaumont. He's the Chief Product Officer at Kyruus Health. I wanted to ask him about two new products that they've introduced recently, one being Guide and the other being Reach. I can't wait for you to hear what those two products are. Let's get to it. Peter, welcome to the program.
Thank you. Thank you for having me.
This is going to be fun. We're going to dive in. I want to talk to you about the new product you've announced recently. But before we get there, can you give our audience a little bit of an overview of yourself, your role at Kyruus Health, and a little bit about Kyruus Health?
Sure, yeah. Peter Beaumont, thank you for having me. Chief Product Officer here at Kyruus Health, and responsible for how we think about product development and product strategy. That means really sort of first and foremost interacting with our customers, both providers and payers, listening to them and to the market, and really thinking about how we direct investment and rationalize our overall product strategy, which includes our core product set as well as new products and bringing new products to market. So yeah, very excited about some of the things that we've just recently announced, which I'm sure we'll talk about in this interview.
Yeah. And on that note, I mean, you've just announced Guide,
Yes.
which is an AI-powered search for members who are looking for care. So this is obviously a payer-focused solution. Can you describe it a little bit more for us and what it really does?
Yeah. So first of all, I think Guide we just launched. It is designed for health plans first and foremost. We saw an opportunity to bring an AI-focused product to market. As we all know, I think there's been a lot of hype recently, but the reality is that generative AI is probably the fastest adopted consumer technology in the past 5 to 10 years. We saw an opportunity to do something different with it based on the 10 years of experience that we have interacting with consumers from a patient and member perspective. We see over a billion searches, or we've seen over a billion searches in our sort of history. And we said, is there a way for us to leverage generative artificial intelligence, large language models, and sort of all of the information that we're seeing from a Kyruus Health perspective, and bring something new to our health plan customers focused on the member experience. And so that's really what Guide is focused on, is improving the overall digital experience from a member point of view. So initially, it's designed to help members find and get care in a more seamless way.
So Peter, let me ask.
Yep.
When a plan implements Guide, what are some of the benefits that they might see from that technology?
Yeah, so our focus with Guide from a health plan perspective and the outcomes that we're looking to drive is first and foremost a better member experience. We believe that we're able to achieve that by better matching and understanding the member's intent. And so we think that is really sort of the initial outcome that we're looking to drive. And then over time, really helping members match to higher quality providers, and then helping them understand and see and have better transparency into the cost of services that they're searching for.
Is one of the outcomes that's expected then is that me as a plan member might be guided to care that's a little bit more appropriate, whereas before I might go to essentially the wrong place or somewhere where it's too expensive and unnecessary?
Yeah. I think the way that we see Guide ultimately evolving and the roadmap behind it is it will drive more personalization for you as a member of a health plan. Our focus on really all of our products from a care access perspective is enabling whether you're a member of a health plan or a patient of a health system or an independent medical group, is to find care that is more affordable, more convenient, and more personalized to your sort of experience. We think Guide is a great example of a product that we're bringing to market that helps sort of achieve all of those outcomes.
Now, Peter, you've launched another product. It's called Reach.
Yes.
Can you tell us a little bit more about that?
Yes. So Reach, we're also very excited about that product. This is something that builds on the 10 years of experience that we have at Kyruus, helping manage provider data for both health systems and health plans. And Colin, I'll tell you today, right? So 70% of the time that a consumer, an individual, you or I, begin searching for care, we actually begin that search online, right? We start typing into Google, we start typing into another digital property like a Bing, we start looking for care, right? Consumer behavior isn't changing, it's already changed, right? We are looking online for care. Reach is really designed to ensure that when we as consumers are looking for care online, that the information that we see in those digital properties is accurate and up to date. And so we're partnering with our health system and medical group customers to ensure that their provider listings across these digital properties is up to date and accurate.
And why, Peter, is this the right time for customers of yours to consider Reach?
Well, so we see it as a natural extension of what we're doing today. So we're managing, provider directories across, the leading health systems in the country, managing close to 500,000 provider profiles. And we see this as just sort of a natural extension of what we're already doing, and taking really the next step and managing it beyond the health system's website and now managing it across, across these other digital properties.
I think it would be a little bit of an understatement for me to say that this is a bit of a strange economic time, and providers especially seem to be under a little bit of financial strain.
Mm-hmm.
But despite this uncertainty, despite the restrictions on budget, to me it does feel like patient access has remained a top priority, and for both providers and even some plans. Why do you think this is the case?
To me, it's really all about sort of keeping the consumer, or the patient, at the center of sort of what it is that the payer or provider is looking to do. Without that, focus, what we're all doing in sort of healthcare kind of, falls away. And so I think despite all of the budgetary constraints, there still needs to be that focus. And really from a Kyruus Health perspective, that is what we are working to achieve from a product point of view, is to bring things to market to ensure that there is a clear and consistent return on investment for our customers.
So Peter, can you give us a sneak peek into what you're working on in terms of new products and new solutions from Kyruus over the next 12 months?
Sure, yeah. So from a roadmap perspective and product strategy point of view, there's probably two big things that we're focused on, which I think are pretty consistent for us. One is continuing to look for ways to enable payer and provider collaboration across our client base, with a focus on data management. And two, continuing to look for new ways to enable care access through that lens of affordability, convenience, and personalization, all through the expertise of data management that we've built over the past couple of years. And I would say, again, really driven by our clients, which are sort of pushing our strategy forward.
Nice. So sounds like a very exciting next 12 months for you.
Yes, exciting and busy.
And judging by some of the customers that were here at E3, you've got a lot more requirements coming on your plate.
It's very true, very true.
Well, that's the nature of gathering your customers together. You get a lot of great feedback, and eventually their hope is that it'll end up in the products, right?
That's very true, very true.
Well, Peter, you've shared a lot of great information with us today. Where can people go to find more about Kyruus Health?
I would say the best resource is kyruushealth.com for all of the latest and greatest on what we do.
Well, Peter, thank you so much for being on the program, and thank you again for choosing this wonderful venue. Like I was saying to Graham earlier, I've never done an interview out here like this, so this is a lot of fun.
Awesome. Thank you, Colin. It's great to be here.
Hey, I really want to thank Peter for coming on camera and explaining what Guide and Reach are. I'm pretty excited actually for the Guide product and how it will help members have a better experience. Just that whole AI-powered search and making that experience for members who obviously become patients, making that smoother, it's just going to help everybody. And hey, if you enjoyed this video, please head on over to healthcareitttoday.com where you can find more great content like this. I'm Colin Hung here in South Carolina. Thanks for being here, and I'll catch you on the next video.